Welcome back, everybody. I'm Van Jones. I'm so pleased to be joined today by Matt Damon and by Gary White. Both these guys are co-founders for Water.org and also WaterEquity. Thanks for joining me. Look, it's a challenging time. Before we get into all the big stuff, how are you doing? How are your families?
Oh, well, it's a pleasure to be with you, Van. Big fan. And we're good. We've been really lucky. I'm actually in Ireland. I was here shooting a movie that got shut down a couple months ago. And we kind of had everything in place, so we just stayed, and it seemed like a great place to shelter in place. So we've been very lucky, and everybody's healthy and happy.
That's good to be. How about you, Gary?
Yeah, same here. We've been very fortunate in this, and as Water.org and WaterEquity, we have staff around the world, and really pleased to say that we've been able to keep all the staff healthy to this point.
Well, I'm glad to hear that. You know, this pandemic is a crisis that's really jumping on a bunch of other crises and making them all worse. You guys were recognized by Time magazine all the way back in 2011 for your work on the water crisis. Now, I'd like to I think people, they may have heard about it a little bit. Tell us a little bit about what Water.org has been up to dealing with that crisis before we talk about how COVID's making it worse.
I'll try to do this quickly. We basically, our system basically what we do is we give we facilitate micro loans to some of the poorest people on earth, so that they can get the water solution that is right for them. And it's been this incredible success story that's scaled a lot faster and better than we could have even hoped. And it's kind of like our pipe dream coming true. And in 2012, we reached our first 1 million people, and we're about to hit 30 million people. So in less than a decade, we're scaling really quickly. And the good news is that this idea that the poorest and most vulnerable people on earth will actually take control and take charge of their own solutions is something that we believed, and we've been proven right. So it's been a wonderful success story for us, and obviously COVID is kind of the latest wrinkle in this journey.
We're going to definitely talk about that, but I mean, 30 million, that's a huge number. I mean, you're talking about scale, you're talking about impact, you're talking about communities that don't have a lot of resources. Gary, what are you doing? What are your unique strategies? People are trying to figure out how to solve tough problems. What are your unique strategies giving you this ability to scale this strongly?
Yeah, no, I think Matt hit on it, and that is we recognized some time ago that the people living in poverty weren't necessarily a problem to be solved as much as they were a market to be served. And what we realized that people were already paying huge amounts of their income to get access to water and sanitation. They weren't able to work at paying jobs because they were waiting in line to get water from public stand posts or walking to distant water sources. And so we asked this what if question, what if we didn't have to have charity to reach everybody in the world, because there's never going to be enough charity? What if we could actually get people access to small loans so that they could get the water and sanitation solutions that they felt were best for them? And that has really taken off. As Matt mentioned, we're hitting about almost 30 million people now. And we've actually mobilized more than $2 billion in capital for these microloans that are repaid at a 99% rate, by the way, and 94% of them go to women. This solution has actually proven itself out, so much so that we've even been able to add a new element to the solution with Water.org, kind of getting these markets ready and kind of working with local financial institutions to help poor people take affordable loans, while WaterEquity, which is our sister organization that's a social investment impact fund manager, allows people to invest in these portfolios and get a return financially, but then they also are able to help us deliver huge social impact. So now we're actually beginning to merge the global capital markets with people living on sometimes less than $2 a day to get a loan.
And that actually, WaterEquity was actually born out of a trip. Gary and I were in India about 5 years ago, and we were talking to these different partners of ours, these microfinance institutions, and we asked them what the biggest bottleneck was, to their work, and they said access to affordable capital. So it turned out the demand was incredibly large, but what was clogging everything up was the fact there just wasn't enough money in the system. So that's how WaterEquity was born.
So you had to get the capital to flow to get the water to flow.
Exactly. Exactly.
You know, I think a lot of people don't understand how hands-on you are about stuff you care about, Matt. And, you know, it's one of the things, you know, for me, I find the most inspirational about you. Can you share any personal stories? I mean, just, you know, you're such a massive star, but you're out there trying to solve these problems yourself. Any personal stories, anything that struck you, anything you've seen that really, you know, moved your heart that you want the world to know about?
Oh man, I couldn't even, I wouldn't know where to start. We take a lot of these trips and go out into the field as often as we can. And just meeting these, it's so inspirational meeting these people. You know, as Gary said, it's 94% of our borrowers are women, and they're repaying at over 99%. And to think about that, like, and put that in context, these are people surviving on less than $2-3 a day, and it's like it's kind of unfathomable to us in the West what that kind of poverty is. And to see it up close and to see these people taking charge of their own lives, it's just incredibly heroic. And so I have hundreds of stories for you. You know, I think we've mentioned that the problem, the reason our borrowers are women primarily is because this issue affects disproportionately women and girls, because oftentimes that's who has to do the water collection. So girls are missing school. Millions of girls all over the world miss school or have to drop out of school because they're in charge of water collection. So you can imagine what that does to the outcome of their life. And so when you see water, you know, delivered to a community, and you talk to these kids and you realize that they're in school, and you talk to them about their hopes and dreams, and they have hopes and dreams. You know, it's the difference between having a life that and living out your potential, or just being relegated to this brutal cycle of poverty where you're just spending every day looking for water so that you can get to the next day. And there's not great hope in a life like that.
Yeah. Well, I mean, you stood up something now, two entities that are trying to bring hope. They're trying to solve real problems. And then here comes this pandemic. Here comes this plague. And I think, like you said, those of us who are in the West, I don't think we really think about how difficult it would be to fight this pandemic if you didn't have access to running water. Gary, can you just talk a little bit about the importance of water in stopping this global pandemic?
Yeah, I think, you know, all we have to do is rewind to the early days of COVID-19. And what was the first thing we were told to do? Like, wash your hands a lot and vigorously. And it's like, okay, check that box, we can do that. But then you stop and think about, well, what if you don't have access to water? And I think that's just unfathomable for us. And it's unbelievable, actually, that, you know, over 700 million people don't have access to water, so they can't even take that basic first step. And so, you know, we see water as a given for us to be able to fight disease. And then you also look at the fact that, you know, if you do get sick, right, if you go seek out medical care and you go to one of these healthcare facilities in Kenya or, you know, the Philippines or India, you recognize that more than 66% of healthcare facilities in low-income countries don't even have soap or running water. So imagine trying to be a frontline healthcare worker and trying to prevent the spreading of disease among people who are showing up to be treated, and you can't wash your hands between patients. And so for me, you know, if there's some hope in this, it's a hope that, you know, water will finally start to be recognized as the hero that it is in contributing to our health and our well-being. And hopefully what we can do is use this, you know, emergency response as a jumping off point so that we can build in more resilience to healthcare around the world, and recognize that one of the first things that led to public health in this country was a stable supply of safe water and sanitation.
You know, yeah, we were talking, Van, we were talking about all this personal protective equipment that, you know, we've heard so much about in PPE, and it's life or death, and it's incredibly important, and we know that. We were talking about it in terms of water. Like, water is PPE. Water's like the very first level. But here in the West, as you were talking about how it's hard for us to relate to water because it's ubiquitous for us. We can go to a tap in our kitchen, in our bathroom. You know, our toilet water is cleaner than the water 2 billion people or almost 1 billion people on planet Earth have access to. So that first level of PPE, we wouldn't even think of that in the West, you know, but it's water. And also, I would just also add that we talk about social distancing, right? I mean, if you're using a community toilet, how do you social distance, right? It's so some of these things are really impossible in these densely packed areas without access to clean water and sanitation. You're really giving the disease all the advantages it needs.
Well, look, I mean, I had not thought about 95% of what you just said, and I consider myself to be a pretty conscious person. So I think you're educating people around the world about what is really needed. What are you guys doing differently now? How are you adapting and changing your strategy to you? I guess you already ramped up from nothing to 30 million people. I mean, what are you trying to do now? How do you deal with this from your point of view?
Mm-hmm. Well, as you might expect, a lot of the work has had to slow down around the world for us right now. But there are like other pockets that are really opening up. A lot of this micro lending that does happen around the world has really scaled back. And yet we also see that as we work with local utilities around the world to help them get access to some of the poorest neighborhoods, we're actually seeing that increase in some areas. And so it is, even now, we're still trying to get our feet under ourselves in terms of how we continue to reach people directly. And that's starting to bounce back. But what we also see is this is a moment to take a step back and say, let's look at how we can help governments more to fulfill what is their mandate, really, and that is to provide water and sanitation services at an affordable rate to their populations. And what we see there, again, is sometimes a lack of finance. And so we're working with institutions, governments and we know they're strapped right now. We know governments around the world are strapped for cash, but trying to plant the seeds for, like, as we get past this, let's look in terms of how do we build disease resilience through safe water and sanitation and get the budgets established that need to happen. And what's unique about us at Water.org and WaterEquity is that we come at this with the lens of the poor. And infrastructure is built, infrastructure is invested in, but what we uniquely bring is making sure when those water systems get built, that the poor are at the front of the line and that they're not marginalized and just kept off the water grid. And so that's what we can do in terms of stimulating the infrastructure through finance, and then kind of holding people's accountable to make sure the poor get served.
You say that like it's an easy thing. And I want to, you got to realize you got people who are listening. They're looking at you with their jaws hanging open. Hold on a second. You're dealing with some of the poorest people in the world, women, and getting them, access to capital markets, infrastructure. Let's just take a step back. You're dealing with very low income, very low wealth populations all around the world. It is hard to get that right. What are some of the things that you learned as you've made your mistakes, if you tried to move forward, that you think other leaders should also learn? If we're going to start, if the pandemic is going to get us all through ripping through these impoverished populations, suddenly those impoverished populations, they've got to succeed, or the rest of us have no chance against this plague. That flips everything on its head. You guys did that yourselves voluntarily. What have you learned? What do you wish people would do more of or less of working with low income, impoverished, low wealth populations so we can all win this thing? I'll talk with you, Gary.
Yeah, I'll jump on that. I think it's important to realize that in the last 2 decades, more than 2 billion people have lifted themselves out of extreme poverty. And this kind of goes back to what I said before. Let's think of the people living in poverty as more a market to be served. And I can just give you one example of that, right? So Matt and I were actually in the Philippines just a few months ago in the fall. And it was in the Philippines where I had met a woman. Her name was Lina Liza. And she was living in a slum near Manila. She was paying about $60 a month for a water tanker truck to come through and deliver water to her home. There was no access to piped water. She couldn't afford to then extend the network to her place and pay the connection fee, which was about $300, right? So what she was able to do with one of our partners is to take out a loan so she could pay that connection fee, get access to the utility. And now her loan payments are about $5 a month. And her water bill to the utility is about $5 a month. And so you can see, going from $60 a month down to 10, there's a lot of capital in this system that's just being directed very inefficiently. But if you can't get over the hump of getting that loan and getting access to a loan, you're forced to pay $2 a day to make that water payment to the vendors. And that's what we're tapping into, the fact that there's this massive wall of capital that could be mobilized. If you multiply her by 2 billion people who need access to water and sanitation, you can see there's a massive wall of capital that's there willing to come from the bottom up. And what we've been able to do is tap that capital from the top down as well through social impact investors like the Skoll Foundation and the Hilton Foundation, and even folks like Bank of America, and can really create a financial infrastructure that allows that market to come together so some of the poorest people on the planet can get access to these services. And I think that's what we're trying to bring about.
I think there's one other thing I would add to that, Van, is a philosophical idea, which is that you have to trust and believe in these people and believe that they want to solve their own problems just as badly as you do, even more so, it turns out. And so I think that's one thing. Gary has just done that intuitively. And I think because he's been at this for over 3 decades, having seen so many water projects fail, half the water projects, globally fail, right? Wow. Usually because they're delivered with this in this kind of paternalistic charity way where it's, here you are, here's your solution. And I mean, a dozen years ago, Gary and I were in Ethiopia and we looked at this beautiful well. It was a state-of-the-art well that an Indian NGO had raised money, so they probably had some banquet in Mumbai and raised $10,000 and built this thing. And it was gathering dust because it was so high tech and it had failed, and nobody in the village was taught how to run the thing. It was just put there. And so when it stopped working, they went back to a hand-dug well, the system they'd been using for hundreds of years, and this thing was just kind of wasted. And so it's like, I think Gary intuitively and water.org, I'd say philosophically, we believe in empowering people to solve their own problems, and that really that's where the sweet spot is for us.
Oh yeah, I think it's really extraordinary because we think about poor people, low-income people, whatever you want to call it. You just point out something I never thought of before, is that there's a ton of capital there. It's just being wasted because, the systems don't work. But, when you say, listen, there's literally, an extra $55 lying around in the hands of a couple of billion people, you could marry that with the big capital and you could solve a bunch of problems. The other thing I think is great about what you just said is that you could do a big infrastructure project, and I'm sure a bunch of them are going to be proposed. But if you don't think about the last mile, the last inch of connectivity, the whole thing is a big waste. Yeah. So,
that's funny. That's literally, Van, that's exactly what Jim Kim, when he was running the World Bank, when we had this conversation with him, he said, I can get the 85% of the people. He's like, it's the last 15% that are the hardest to reach. It's like, he was making exactly that point.
Well, I think it's great. I think this virus is here to teach us about oneness and wellness. That's what I think. There's always a lesson in a plague if you read the great books and all the sacred texts or whatever. And I think this is about oneness and wellness. You guys have been trying to deliver on wellness from a point of view of oneness, really respecting other people. I wonder what I think about you, Matt. I mean, everybody knows your face. I mean, you can't walk on any continent. Probably the penguins know who you are. You go to Antarctica. Of all the things that you could be doing, what was it that got you doing this? Because you could literally do anything you wanted to. Any cause would be happy to have you. What made you decide to pick this cause?
As I started looking at all these issues of extreme poverty, I was really interested in getting involved, and nobody was talking about this. This is 15 years ago or so. And as I started to study and learn about it, I just realized that it undergirded everything. It undergirded all these other problems. And it was we're losing still 1 million kids a year completely unnecessarily. I mean, this is a problem we solved in the West 100 years ago, right? I mean, if one of my kids has a bout of diarrhea, that's not a life-threatening experience. It's like maybe they miss a day or two of school, and because they have access to clean water, which is all you need to stay hydrated, and you're going to get through it. But yet, if you don't, something as simple as that, right, can mean the end of a child's life, and it is for these completely ridiculous reasons. We're still losing people. I mean, imagine if we cured cancer, and in 100 years, the very poorest of the poor were still dying of this thing that we cured, right? It's unconscionable. And so I started to get really interested in it. And then, eventually I realized I had to get really serious. And I partnered I went for the greatest expert I could find in the water space. And when that person wouldn't take my calls, I found Gary, and we've been together ever since. Gary pioneered this idea of water credit, this idea that the municipality was already pumping water right under the feet of the poorest of the poor. They just couldn't get a water connection. And if we could front them the money, you would buy back all that time they were spending waiting in line and at a community tap that only came on once a week. And you would suddenly buy back their lives and allow them to go work and pay off that loan. And it was this idea that just was, it was just a perfectly simple and beautiful idea. And he was unbelievably right about it. And the rest is history. So we're marching on. We're hitting 30 million soon. And then it's onward from there. I mean, they have identified about 500 million people can be reached with this solution alone. So there's a chance to make a huge impact to any high net worth individual out there watching. If you want to make a real name for yourself, give us a call. We've got room for you at water.org.
Amen. The fact that Time Magazine recognized you guys, years ago, and that wasn't the peak of what you're doing. That was just the start of what you're doing. And now there's such a big, massive need. We got a question from somebody named Diana, who just wants to know a very simple thing. Diana in Argentina, how can I help? We know if you're a gazillionaire, just call these guys up, give them a bunch of capital, they're going to put it to good use. What do you want ordinary, regular folks who may not be billionaires? Maybe Diana is a billionaire, but assuming Diana in Argentina is not a billionaire, what can folks do?
Yeah. Well, I think right now, we are focused on COVID-19, and that's appropriate. And there's a lot of immediate steps that people are taking and providing, support for relief efforts. I think as people get beyond this and look at a different dimension of it, and that is the resilience, give support to resilience and see water and sanitation as resilience. And of course, at water.org, we're putting, everyone's dollars to great use to that end. And I think what we also need to look at is beyond that. You talk about the oneness that we all have as well. And as long as one of us around the planet isn't healthy and doesn't have access, then none of us are going to be healthy. And I think COVID-19 has driven that home, that we are one. And a disease that emerges, in a slum in some place halfway around the world, next month can be in your neighborhood. And I think that's why it's important for us to look at resilience across the human family. If it's not a moral imperative to do that, to help those people, it certainly is enlightened self-interest on our part to make sure that we help the whole world stay free of things like COVID-19.
Last question. 10 years from now, God willing, we're going to be past this pandemic. Hopefully we'll have learned a ton. Hopefully we will have come more together. But there's still going to be challenges out there. 10 years from now, what do you hope that water.org and WaterEquity will have accomplished and will be doing before we close? Give me your 10-year moonshot here.
I hope we're out of business. That's my moonshot, man. I hope we get put out of business because it's no longer an issue. And listen, it's that sounds like a crazy moonshot, but so did the moonshot. And we do see a pathway to that with the proper engagement. This is a problem that is solvable. This is completely solvable. It just takes global engagement, and it's about the will to do it. I can tell you the women that these women who they're heroic. They're the poorest women in the world, and they're paying back loans to buy themselves out of this problem, to solve their own problem for themselves and for their families. I mean, it is a remarkable story. and hopefully one that we're going to tell about 800 million more times, and then we'll be through with it.
Wow.
And it is going to be a heavy lift, but we can get it done because we'll do it in partnership. I mean, the Sustainable Development Goals, number 6 is water and sanitation, and the world is aligning behind it. And I just want to make sure, I mean, this isn't just us, right? We have kind of sparked some new ideas and some new thinking, and some hypotheses have borne out, but we're collaborating with everybody to make sure that we can reach that goal so that we're all out of business in 10 years, when hopefully we'll have reached all the Sustainable Development Goals and put things like this behind us.
Well, listen, it's just an honor to talk to you. It's so inspiring. You know, you got a lot of do-gooders like myself, and we go up against these impossible odds. And when somebody has a brilliant idea, simple idea, and they execute it well, and they got the numbers to show for it, and they got the vision going forward, you deserve to be Time 100 forever. Thank you so much for what you're doing. I hope anybody listening reaches out and gives a hand here. Water is PPE, period. Full stop, drop the mic.